stimuli out there that we have no idea about. Or at least we have no idea about it. We don't know that it's not affecting us, like electromagnetic radiation in other spectrums. Who knows what they're doing to us? We can take some measurements. Sometimes we see effects or not. But anyway, our biology has simplified our lives, our ability to cope with complexity, made possible by limiting what our perceptions pick up. And then, of course, even things that you see, visual information goes in, doesn't mean that your brain picks up on it. Or your brain may reshape it. So you have optical illusions, where you see something, and then on closer inspection, it turns out that's actually, it wasn't a full circle, there was a little gap, but our brain made the simplification of saying, yeah, that's a circle. So we also have these maxims that we live by. So some people say I'm interested in significant results or evidence-based decisions and things like that. But that's reductionism that is extremely effective for practical living and managing the challenges and interacting and enabling our species to flourish, at least in terms of reproduction and longevity. But they also occasion major problems where important elements of a situation are overlooked. So simplifying, unfortunately, probably often entails oversimplifying. Models are evaluated and declared useful, effective, and accurate based on what we regard as important, though inevitably incomplete criteria. For obvious practical reasons, the criteria must be observable, right? Measurable objectives, but not everything can be observable. They need to be relatively near term because we have to make decisions, we have to move on, we have to get promoted, whatever it is. And they can't be too subtle, we won't notice them. And they have to be important, at least in terms of what we regard as important, based on our preconceptions and values and things, pressures, and so on. So, for example, let's say you have a teaching innovation, and you'll see that we tried this innovation, and students did better on their exams, and they were happy with it. So we declare that a success. What if one of those innovations actually hastened the onset of Alzheimer's by a couple of decades in those students? We'd never know. Was it still a success? We would assume so until decades later we found out otherwise. We can't know, basically. Life is too complex. So science is a very effective system that is highly accomplished, but it is really a broad conversation in which different investigators and investigator communities explore, present, critique, debate, and persuade or not persuade others until some kind of consensus is reached. And that can possibly be upset when a new discovery is accepted. So the process of science involves persuading peers and gatekeepers, other people who fund your grants and decide whether your paper should be published. And if there are criticisms that are published, we say, yeah, that's probably accurate. But, is that a real way to tell if something's true? But, what else is available? There is no arbiter. There's no oracle up there we can go to and say, so is this really right or not? Some people regard God as the ultimate authority, but where do we get the word of God? Typically, I was listening to it yesterday in the taxi as I was coming from the airport, but the driver put it on, and I heard the word of God. I actually recorded it. If we have time, I could play something. But a lot of people live by that. And I'm not saying it's wrong, I'm just saying that it's coming from, I didn't hear God on the radio, I heard this preacher. Right choices are elusive. Most actions have multiple effects. And some of those effects are good, at least in some respects, and others are bad or not good. Some of the effects occur in the present, some occur later on. Some of them occur in the local situation, some occur at a distance or indirectly. Because of diversity, a given phenomenon will affect different people differently. There is no one size fits all. So actions that affect some individuals and groups in one way and other individuals and groups in other ways are going to be regarded differently by the different groups. Like where you stand is where you sit kind of thing. So most important questions do not have right answers. Should we raise the tax on gasoline? Should we do this with immigration? Should we do whatever it is? There are answers that are right for some and not for others, or at least it's not seen that way. There must always be trade-offs. And typically, we don't have a full accounting. And this is not on an abstract scale, it's in relation to people's interests. But in a sense, it doesn't matter. Because people see things their own way anyway. We don't make decisions individually or collectively necessarily based on evidence and what is right. First of all, there's no way to recognize what's right, as I was just saying. If there's something we don't like, we don't necessarily believe it. If we don't think something is going to be favorable to our interests, we're very disinclined to believe it. And the policies that actually emerge and are implemented are the outcome of a competition and cooperation among the various agents. Life is an emergent phenomenon and the outcome of these interactions. So, some people claim that we're evidence-based or rational. Some people claim that political leaders, some of them are not rational. But humans, for the most part, advocate and pursue what we regard as in our interests. And I mean regard and interest in a very broad sense. So my interest might be to help certain other people. So I could regard it because this will be helpful to African Americans, or this will be helpful to Latinos, or this will be helpful to Muslims. I can have that personal interest. And so, but then I will be evaluating things in relation to that interest. And that pursuit affects our very perceptions, partly by what we pay attention to, if nothing else. I listen to some things on the radio, I don't listen to other things. But it also affects our judgment and what we devote our energies to. So some implications. If society is emergent behavior, I think we need better agents. So you might say, well, we should redesign society so it works better. But who will do the redesigning? The redesigning has to come from those agents. So, I mean, that may seem better humans. Yeah, I mean, actually, we all believe in that, really. I mean, how do you make better humans? Well, one thing is you make them literate, right? People who can read and write are able to function much more effectively. Religions have worked on making for better humans. Do unto others as you would do unto yourself. Commandments, principles, things like that, many of which have been invaluable in avoiding the slaughter and just brutality that has gone on through millennia, many millennia. It still goes on, but I gather it was worse in the very old days. So people can be better. They can be healthier, for example. And healthier people who have less lead in their systems, for example, people who got enough iodine when they were growing up so they didn't grow up mentally retarded, are better people. And their interactions work out better. So we would certainly not advocate a situation where, why don't we create a shortage of iodine, and we'll have more mentally retarded kids, but that'll lead to a better society, won't it? I mean, you'd all say, hey, that's totally crazy, that's totally ridiculous, because we know that the quality of the people affect the quality of the society. So if we can make people better from where we are today, certainly on average, I think that should be possible. For example, we know that the kinds of resources when invested in early childhood development improves children, and that improves their schooling. I mean, it improves them at birth, in their very early years, their schooling, their accomplishments later, their earnings, all this sort of stuff. So we could have better people, and if we had better people, this emergent phenomenon of society would be better, I think. Now, one aspect of people's interaction is basic contentment or discontentment. When people are discontent, it stimulates them to action, but it also creates friction. And it may lead to negative kinds of interaction. So, and that may be contagious because these people here, they want to have the statue torn down. And that bothers me. So I'm going to go there and march to keep that statue there. And I'm going to do it in a way that shows them I mean business. And then these people are going to come back and say, yeah, okay, well, we're going to get all these people. And you get all this conflict and stuff. But it may be arising because of basic discontent. And if people were a little more contented, maybe they would find a way to get on with each other better. Because in other circumstances, like when there's an external threat, often we band together, or a hurricane or something like that. All of a sudden, these people that we wouldn't give the time of day to, now we're depending upon them, we're really appreciating them and so on. So it's not that people are necessarily problematic to the extent, but certainly their actions can be for us. So I think if we were more content in our lives, not bothered by things as much, we would be able to interact more fruitfully. So one of the problems with the emphasis on health disparities is it may be increasing discontent. I'm not saying that health disparities are okay, I don't think they are, but if the improvement, there was a graph I just slid over showing the decline in infant mortality, dramatic decline in infant mortality during the last century. And then Bill showed that the ratio of infant mortality is still about 2 for blacks and whites. So if you focus on the first one, you say, what a wonderful triumph, and everybody benefited, because African Americans benefited too. If you focus on the second slide, you say, you see there's still no reduction in disparity. I don't know. I just had that thought that, wait, maybe are we making things harder for ourselves in terms of what we collectively want to see? So if you look at society through the media, just listen to the NPR or something, or daily interactions, and I just put some random examples out. You see cooperativeness, you see helpfulness. You also see corruption. There are a lot of societies where it's very hard for them to make progress, or parts of our society where because of corruption you don't get help from government officials. Services don't work the way you think they should. It's very unfair for people. And what is it that leads to that corruption? That's individual implementation. The laws say one thing, but give me $20 if you want me to file this form. You see anger. And these get in the way of a more fruitful interaction. Your arm has a flexor and extensor muscle, and that's what enables your arm to move smoothly and have precise control over it. But when they both tighten, then the arm shakes and you don't have precise control. And so we're locked in conflict with each other, and that can produce rigidities. You see rationality and irrationality in many spheres, and it's not all on the right or the left or anything like that. Religion, I mentioned only briefly, but it's a huge force that we don't pay much attention to. And it greatly conditions how a lot of people react to things in positive ways, like the Houston volunteers who went out and did all sorts of things for the flood victims because that's what their church wanted them to do, or they believe that's what God wanted them to do, and then others who acted in other ways. There's the question of flood insurance. I mentioned no right answers. How should flood insurance work? Should the government make everybody harmless if there's a flood and you didn't have insurance? Why would anybody get insurance? On the other hand, how are you going to stop building in places that get flooded if you always get your things rebuilt? And yet, if we don't provide support for people, how can we afford to let all these people just go be devastated by a flood? And these are not easy questions, and they can be solved to the extent that they can be solved only through a cooperative interaction among all parties. Muncie, Indiana, there was a news story about opioid use, how that's such a huge problem. So how am I doing in time? I have about 15 minutes? Okay. So I came across this article. When people have slept less, it's a little like looking at the world through dark glasses. This is an Ohio State researcher. Their moods are poorer, they're grumpier, lack of sleep hurts the relationship. Couples' shorter sleep duration, this was an experimental study, was related to higher stimulated cytokine production after marital conflict. People who slept less behaved more negatively and less positively only when their partner had also slept less. So if one of you gets sleep, that may actually be a safety mechanism. Yeah. One's own and one's partner's use of emotion regulation strategies during conflict buffered short sleep-related inflammatory reactivity. So sleep is very important. Sleep deficit is widespread in our society. Who knows what impact that's having? How much of the election manipulation that Russia is supposed to have done, this was from their Facebook, their Twitter and Facebook feeds, where they're putting out this false stuff and arousing emotions and getting people riled up. How much of that is influenced by the lack of sleep that people are getting? It's certainly influenced by lack of critical thinking. and a willingness to believe anything. I mean, we're creating situations that have, you know, I'm going to have to skip over this just for time, but take a look at this stuff. It's interesting. So some new possibilities. What can we do to make better agents, better people? One thing is rest. So there are other kinds of rest besides sleep. And transcendental meditation, which is something that I learned in 1972, thanks to my brother, and have practiced it ever since, and took advanced courses, and became a TM teacher, actually. Never did the research that I thought I was going to do, which is what attracted me to epidemiology. But the other people have done the research, and hundreds of studies. And it's now becoming something that I think public health is becoming aware of. So I was going to play, there's a 1-minute testimonial, so to speak, from Tasha Daniels. See if this thing comes through. I don't know if the sound is on. That could be a problem.
Turn the volume up.
Yeah. That's up. Is that volume about right from here?
Yeah, there's no video.
It's what?
There's no video.
Oh!
Okay.
Well, that's okay. It's a pity. The video is very nice. I don't know how to get it there, but I don't want to take the time to figure it out, unfortunately. So I should have tested it.
I think we need to realize that stress still happens. It's just the way I deal with it changes. Because I think when I first started with TM, I even thought stress would just disappear. No more stress in my life ever again. And it's not that stress doesn't happen. Things still happen and don't go as perfectly as I wish they would. It's just the way I respond to it is different. And I have like a split second where I stop and can look at, step back in the situation and realize that I don't need to, that I can be calmer and react to it in a better way. And I think that is probably the best thing. I mean, there's also the whole, like, you just feel better, like your body just feels better, and you sleep better, and all that's good too, but for me the biggest thing is just that I can handle stress a lot better.
So, I'm going to stop this. There's a child psychologist who was using or talking to children at one of the schools where they brought TM in about what difference it's made for him. And he said, well, when I would be walking down the hall and someone would bump into me, I'd hit her. And now that I've started TM, when I'm walking down the hall and someone bumps into me, I think, do I want to hit him? And that's a big improvement, actually. So, get back on track here. So I've got a slide here with some links to see a researcher, a neuroscientist at Maharishi University Management, who was giving a talk where I got a recording of it, and he's showing the brainwave patterns during TM. And he also has what he calls a brain integration report card, where he can measure the coherence of the brain waves, and then he had questionnaires that related that to important other considerations in the kinds of things we like people to be, like open and not prejudiced and positive, have high values. So there's a school in Fairfield, Iowa, the Maharishi School of the Age of Enlightenment. And according to one visitor from Florida State University, the students have the longest attention span of any I've seen in 30 years of teaching and educational research. A reading consultant from Washington, D.C. said, I have never felt such a calm and silent atmosphere in a school of like-minded with children. And the Iowa Teacher of the Year for 1996 from Marion, Iowa said, your school was truly an inspiration. The inner peace, the concern for one another, the respect and thirst for wisdom, and a holistic approach to children are awesome. Now this is a school with middle class and upper middle class children. But this is a school, or these are schools in San Francisco, public schools, in disadvantaged neighborhoods where they had, one was known as fight school. They had serious problems before. So this picture, which shows 900 students at this high school practicing TM, along with former Surgeon General Vivek Murthy in the, up on the left, sitting with one of the students, and then there's a picture below from Visitacion Valley Middle School, showing Vivek Murthy meditating with the class. So in those schools where they first introduced the TM, they call it Quiet Time, the TM Quiet Time program, 2007, the kids meditate 15 minutes in the morning, 15 minutes in the afternoon before they go home. Suspensions went down by 50% in the first year. They went down by 70-something%. Absenteeism went down by 70-something% after 3 years. There was an NBC News program on it. The Unified School District of San Francisco put out a data report with, I don't know, 30 tables in it from data they've collected in the different schools, from students, from staff in their head office where they did a randomized trial, and others, and it's a very impressive situation. There were 4 schools that started the program. I think 10 are on the waiting list to get into it now. The funding was originally provided by the David Lynch Foundation in New York, or in several places, which has promoted these schools. It has made this Quiet Time program available in hundreds of schools in the United States and abroad. There are thousands of students in Latin America, for example, who are participating in it, and there are schools in the Bronx, in Brooklyn, in Chicago. The Chicago Crime Lab at the University of Chicago gave them, I think it's now up to $1 million to do this program in Chicago public schools as a violence prevention initiative. I have a talk by Randolph Carter that I have the audio of in my virtual library where he talks about it. But there's even more exciting and, for a lot of us, I think a little hard to believe things. So among the hundreds of studies on the practice of transcendental meditation, there are over 50 studies of individuals or groups practicing TM and or an advanced program called the TM City program, and the association of that practice with indicators of the larger society's quality of life, such as indicators of conflict. So we all meditate, if there are enough of us, and New Orleans crime rate goes down.